When we're able to show up on site, it removes a lot of that fear and trepidation from the clinicians. There isn't a single clinician, whether you're an MD, PT, nurse, chiropractor, that ever wants to look like they're incompetent in front of a patient. This just adds to what they already are doing to get a better result. My name is Jeremiah Jorgenson. I'm a physical therapist for 24 years. Been practicing with Stimpod for the past 4.5 years. This is the device we're talking about today. It's a Stimpod. It has a needle applicator to dose radio frequency and an alligator clip that we connect to an electrode, and allows us to provide very low dosed pulsed radio frequency to the human body to help stimulate and heal nerves. Traditionally what happens, clinics decide that they want to improve the quality of care they give in their clinic, so they end up purchasing Stimpods to put in their clinic. They also purchase us flying in to train all our staff, whoever that might be. And we try to tailor that to what they treat in their clinic, because some people treat pelvic health, some don't. Our job is to tailor that education experience to whatever that practice needs. Also, on top of that, we traditionally will offer at least 2 workshops where they can invite clients in. They could be past clients, they could be new to the clinic, and we will actually do an education training, letting everybody know what Stimpod is, how we can treat neuropathy and support them. And after that experience, then some of them are treated a little bit at the time of it, or they get a demo of what Stimpod will feel like. And then they get to make the decision if that's something they want to pursue forward with those individual clinics to be seen, either later that week or follow-up care down the road. When we're able to show up on site, it removes a lot of that fear and trepidation from the clinicians, mainly because most of us have been trained in electrical stim, been trained in modalities, but radio frequency, although there's nothing to be worried about, your setup and your protocol on how you treat is slightly different. People get a little bit worried when they're going to be thrown clinical questions and say, well, why did you set it up here? Or what if it doesn't work? And when we're able to be on hand for that and walk them through, it just opens their brain up that this is something that they can use with what they already do and know, rather than thinking it has to be, set in its own island. And it just removes a ton of that stress, fear, anxiety of people thinking that they have to be perfect at it, because the care they're giving is already great. This just adds to what they already are doing. Traditionally, these are held in the clinical space that each practice has. Sometimes they're held in an offsite if there's either more room, or if their clinical space with a gym or other treatment areas just doesn't allow for, sometimes there's 20, 30 people. There's other places we do this in Bermuda where there's 70, 75 people show up. They just have the opportunity to feel like they're part of a community where other people around them have a very similar condition that potentially they've been told, there's no solution for this, or there's no option for your care, so continue with your medication. So they come in and there's a ton of very like people with similar conditions, stories that they have. It's the grassroots level of education of letting people know that there is a solution for most of them, rather than just assuming that, I tried PT elsewhere, I tried chiropractic care, I've tried injections, and nothing worked. It removes that sterile clinical environment of where people think they just need to come in for an evaluation. They also learn a lot from everybody else that's an attendee there, because we ask a lot of them questions and try to keep it engaging. Traditionally, what works very well with Stimpod is general neuropathy, diabetic neuropathy, that can even be chemotherapy-induced neuropathy, failed back syndromes, upper extremity issues from shoulder to brachial plexus, carpal tunnel. We treat migraine history patients, trigeminal neuralgia, Bell's palsy. The big one that everybody's curious about is anything that's incontinence related, or even the cancer related with bowel surgeries and that, where people have all this pain because it's not an intrusive treatment at all. And people can be treated, publicly sitting somewhere. Kind of blows them away that something can be this beneficial. It doesn't have to be that intimate as far as the treatment and still get a huge result. On average, we get 40 to 50% of the people that, because of the chronic pain or the limitation that they've been having, or even, motor facilitation of somebody that's got foot drop, if they've had a stroke, and you wake that area up, it's very dramatic in most cases. The challenge is sometimes the body will reset itself afterwards and not hold on to that necessarily. But the benefit for sure with Stimpod, with the whole progression of the treatment, is if you're not noticing something in the first 2 or 3 sessions to where you feel like it's beneficial, then either we've dosed it incorrectly, or your blood sugars are through the roof, Or is there something more going on, like severe swelling or lymphedema? And in unfortunate cases, sometimes if people are on a lot of nerve pain related medications, it's hard for their body to kind of feel, what that treatment is doing. And so it's sometimes just not the right time for somebody to be treated. Doesn't mean it couldn't work, doesn't mean that what they're on for medication isn't appropriate, but sometimes we just have to wait so some things can line up. Because if they've just started a new treatment, they've just had a steroid injection or something else, then it's probably okay for this to be a pause a little bit so their body can settle in, to make sure that we're not chasing symptoms. Because the whole part of Stimpod is not to go in and chase symptoms anymore. It's to actually help treat and support the nerve from, the motor and sensory pathways, and then also calm down the sympathetic system. The benefit is twofold. Some people, when they're coming in clinic, if they have enough other orthopedic or weakness, balance issues, things that need to be treated and followed up with the care provider, then it's a great time to do that. Because like I mentioned before, this just adds into the care that they're already given. Even if a patient lives 5-6 hours away, their ability to be able to find the location, treat, adjust protocols as things change can take a little bit. And for an untrained person, that's a little bit overwhelming, which is why the on-site training, even for all the medical providers, is very beneficial, because there's a lot of little nuances to it, and they live far enough away, then it's completely safe that somebody could treat themselves at home. Because if they have enough of a pain response that they need the vagal stim that Stimpod can do, then they might be somebody that needs to be treating, more frequently, which sometimes is twice a day or every single day for the first few weeks on that particular protocol. And then the others are pulled back a little bit to 2 to 3 times a week, because we want to make sure we're not overstressing the nerve. And so for some people, even if they're preoperative, they may want to rent a unit or use it at home, or purchase one if they have more of a chronic condition, because they're going to be needing that increased frequency that the twice a week for them to get to clinic might just not suffice. I've been treating neuropathy probably for about 14, 15 years prior. The challenge was all of the devices on the market, because regular electrical stimulation, by the way it affects the human body, it adapts, so you have to keep turning the intensity up and up and up. Stimpod goes the other way. As you tolerate more, or your body is facilitated easier by Stimpod, the intensity can actually go down to achieve the same result, so you have less of an effect of overstimulating someone. And we also use it for assessment, because when that happens, we know where normal healthy tissue should be when it's dialed in, and what the output should be. And so as you get closer to normal, then we don't also have to turn it as high to get the same response. And as a result, the capacity to see patients heal at the same rate, even with where they had started, allows a lot of clinicians to be far more confident in treating neuropathy, or even the pelvic floor dysfunction, because that's not anything I want to do. Don't want to be doing in depth, or the state I'm in, I can't be doing the evals. Great, you don't have to be. Let's support them on the functional side of what's going on. And when we're able to achieve that, it just opens your doors to what most people got into physical therapy for. And that's, to be able to help and treat more people. It doesn't always have to just be a single niche. I got into physical therapy because I wanted to help people. I took some post-grad courses for 2 years, about 20 some years ago, to push what I was doing as a PT. For me, it's never about me. It's being able to empower all those other clinicians and people that thought before that they couldn't treat something, or hearing somebody, when you're presenting, this is what Stimpod can do to knee pain that they've had for 14 years. They had a total knee replacement, been 4.5, 5 years. And they tell you, I've tried everything, nothing works. So I'm glad you think that's going to help me, but we will see. And, they have that hesitant laugh. And then you treat them and they get emotional, right? That's really cool. Or family friends of mine that have had issues with incontinence that, they shouldn't be. They're 50, 60 years old and been dealing with this the last 4 or 5 years, and been waking up every single day at 5:30, 6 a.m. to do Kegel exercises and do what they were told by pelvic health PT. Nobody's fault. Just they got to a point and said, I guess life's going to have to change a little bit, because this isn't improving as I wanted it to. And I was a very active person prior. One session of Stimpod and blew them away, and to the point that they're back almost not having any issues at all of leaking during the day. And when you do that for someone as a very motivated, individualized person of also not wanting to even share those intimate details of what they're dealing with, because they're a proud person and realize I just need to live with this and deal with it, because people have stuff far worse than them going on in life, right? And so when you can share and give that, it's really, really cool, because the device in itself is what's doing all the magic. We just have the understanding of being able to go back and figure out how do we reverse engineer this to the body when you understand the nerves? You get to make a big impact when you're sitting in a room of 20 people and know that 60, 70% of them decide to come in for care. And one-on-one as a clinician in a clinic, no matter how many providers you have in your clinics, you usually don't get that same impact. So the workshops are really, really good to be able to give back to the whole community of the public, and then to be able to share the impact of the care that's given when otherwise, a lot of these people just accepted that this was their new norm is really cool. So for me, that's where a lot of that why comes from. It's finally being able to give back at a little bit bigger pace than just treating one-on-one care. When people decide to get the one-on-one care and we show up, the one-on-one care piece allows the clinicians to hit the ground running come Monday morning to begin treating. The people that decide, I'll just figure this out on my own, show up, put in the work, it's a lot. And it's not intended to be that way. But when you give respect to the human body that this is what's going on, and to understand how do I safely progress through the weeds on this diagnosis, that's where you need the support with somebody standing beside you. If you don't do that in clinic with someone where they pull up patients and say, what do I do with this one? How do I go through this treatment? Because often until that happens, they're not using it on every single patient all day, every day in clinic. Well, when we show up, it is a full caseload all day with anything that you have on the books. This is what we're going to go through and we're going to use it on them. And so they get to take their own notes or figure out what their protocol, how often, or they're twice a week. If they're doing better, what else can we do on this other day of the week because of where things are at? And I think the bigger progression is just for everybody to accept that this allows the cash pay piece for healthcare, which as things move forward, all of us are understanding that anything we want in our world, we pay for it. But we were indoctrinated to think that health insurance has to be my holy grail to tell me what I can or can't have to get better. And the unfortunate piece of that is it probably does okay for 90%. But when you fall into conservative rehab care that needs something different, medications clearly don't work. The research shows that. It'll keep you from dying, but it's not going to get you past your condition soon enough or well enough that your quality of life is going to be what your expectations are. So this helps meet the quality of life expectation and the need from the healthcare side. It's also educating the clinicians that they're going to have to step into a role for most of them where they're uncomfortable and charge cash for that. And there's a ton of value as a provider when you appreciate and realize that's okay. You shouldn't just have to hide and wait and have somebody tell you what your value is. You need to be able to be there and to support the people. And the more clinicians that do that right away, they actually feel a lot better even having those conversations with patients and filling the books and going, you know what, I'm happy to be here and see somebody and add in Stimpod and be now at 30-minute sessions or 45 versus where I was, because that value builds on itself differently than when you were in clinic thinking, well, I can't treat you with this because it's not covered by insurance. And the more we continue to support and push cash pay, there's going to be more of a push as well, because it's going to get in front of more and more people. It allows us to do that when we charge cash for these services rather than just waiting for insurance to decide it. And there's nothing wrong with that because there's safety and health issues concerned in a lot of medicine. But when devices are very safe and kind of novel in their approach and what they do to the body, and then it's just the technology that does all the work, we just have to find a way to get to the masses. Clinics that we visit are all over the United States. I actually leave next Tuesday to go to Alaska. I've been to New York, Ohio, California, Washington, Texas, Florida. We have a lot of clinics up on the East Coast, New York, New Jersey, Baltimore area. And that's kind of, where things are at. But truly, we have clinics all across the country. We've got some in North Dakota, South Dakota. It's really limitless because neuropathy doesn't really have any borders, right? Treats everybody, doesn't matter what your condition is, doesn't matter economic status, it's there. So clinics are dealing with this all over. And so we travel and support those clinics. I think the only one we haven't gotten to yet is Hawaii, but we have gone to Bermuda. And so it's wide range of people we support.